It's an honour to be here with you today. I'd like to start by acknowledging the traditional owners on the lands that we meet and paying respects to elders past, present and future. I was asked to participate in this process, and in terms of my role in the department, particularly around mental health and wellness, Faith and I had some conversations about how I could contribute, and we discussed at length about space and how space is a huge contributor, and the way that we engage with the environment in order to support wellness and well-being. Not only, and particularly my experiences around providing an office space for our staff in the department, and what the experience COVID has had on the way that we work and the way that space has impacted our wellness. But what I'm going to talk to you about is just give you a sense of what Queensland Health's role is in health and wellbeing, how we're going about doing that, and then some of the work and examples specifically around space and how that has influenced wellness and wellbeing in our organisation. Yes, I'll let you get up the presentation. So I'll start off by talking about the health system in Queensland. It's incredibly complex, and at the heart, in the blue inner circle, you have the hospital and health services, which is the hospitals that you would see and that you would associate the health department with. But there is a complex network of secondary and primary healthcare, with the federal government providing Medicare and access to GP services. There's a critical component of our public health environment and the state of our environment in general, the air quality that we have, the water quality, all the systems around us that support the health of Queenslanders. And this is just to give you a sense of how complex and interwoven those complete components of the system are. And that there are many different variables and factors that influence our health. Part of the conversation with Faith was sort of predicated on the idea of saludinogenesis. And that is really about looking at health, not from a disease perspective of investigating diseases and how they influence, but what actually affects wellness. What is wellness, and how do we actually design and support and promote wellness? This is a pretty iconic image that is embedded in the thinking about saludinogenesis, and that there is a river, and the river runs more rapidly towards the end, and there is a level of wellness that starts at the top, where it's easy to be well and it's easy to stay well, but that you might fall further closer to the waterfall of the end of life, and that the goal is to actually move across the page, across the river, as easy as you can to maintain your wellness. The concepts that I intend to talk to today are really around how do we support a wellness environment? How are the things that we can do in terms of promotion, education, preventative, but also in that more intense secondary and healthcare environment that support getting better and support a wellness environment. And in particular, how space and how environment affects our wellness. This is just to give you a context of how Queensland Health is structured and what the scale of our asset base is. So on the left is the structure of the department, where we report to the Minister, and the department has a number of different internal divisions that support statewide systems and activities. And the area that I sit in is the Corporate Services Division, working on how do we support the structural HR, finance, assets, governance components of the system. And then the hospital and health services run services out in the community. So they have their own line to the minister in terms of delivering clinical outcomes. And we're looking at system-wide, and we work very collaboratively together as a network system to support the outcomes that we try to achieve. On the right is a representation of all of the facilities across Queensland that the system supports. So each of those boundaries represents a hospital and health services that is responsible for their assets. And there is over 2,500 facilities across Queensland Health with buildings and assets that are required to be maintained and that support healthcare in some way. This is a snapshot in our strategic plan for Queensland Health, and just gives you a sense of the scale of healthcare services and the burden of disease that we are responsible for delivering. Healthcare makes up a significant proportion of the state budget. We have over 90,000 workforce. We're supporting a population of 6 million in order to work in all facets of that healthcare system. And people are getting older and we're having a greater sense. So growth in healthcare in Queensland is significant, and it comes at a cost of providing those services. So there is a lot to do. This is the vision for Queensland Health. And we've had this probably for about 5 years now. And this really sets out the core components of, as an organisation, what are we focused on? What are the goals that we want to aspire to? And our aspiration is by 2026, Queenslanders will be among the healthiest people in the world. And we've really focused that on the 4 key areas of how we need to direct our attention as an organisation. And the first of those that I want to talk about is promoting wellbeing. We know that preventative measures are far cheaper as well as effective activity in terms of addressing healthcare. And if you think back to the river of health, and that at the top, in terms of the ease of maintaining your healthcare, if we can work in the promoting and preventative healthcare space, it's something that becomes easier to do. Our aspirations in terms of the promoting wellbeing is that a healthy choice is an easy choice. It should be easy to make healthy choices, and if we can support that, then we're going to have an easier way to maintain your healthcare. Also, a wellness model for healthcare rather than an illness focus. How do we support wellness? How do we ensure that people are well and not focus on the disease that people have, but try to encourage a sense of wellness? And we need to incentivize a healthy lifestyle. How do we make sure that if you do the right things, the Queensland government has a thing called the Queensland Plan, and most of these information is actually publicly available if you want to go search government websites. And this is just giving a sense of what the focus is for the Queensland government in terms of health and wellbeing over the next, I think it's 10 years. We know our people are living longer, and when people live longer, we know that there is a greater requirement of care in those formative years. 3 in 5 Queensland adults are overweight and obese. It's a huge focus for the government to work on how do we address obesity rates, because we know that obesity is a huge determinant of cardiovascular disease and other chronic illnesses. If we can reduce obesity, we can reduce the burden on the system. Encouraging physical activity, continuing our drive on reducing smoking rates. There's been a significant reduction, as you can see there, from 2001 to 2012. And in Queensland, skin cancer is a significant component, and hospitalisations, we know that there's going to be a growth in healthcare, secondary healthcare requirements into the future, and how do we accommodate and how do we try to address people staying less in hospital and getting out quickly into an environment that's more conducive to returning to health. One of the ways that the Queensland government wanted to focus on this is how do we bring a greater attention to promotion of healthcare and wellness, and in particular wanted to establish a statutory authority that was independent of the department, and particularly supported programs around addressing obesity, looking at a broader sense of how do we create wellness in our community, and how do we support those initiatives that promote positive outcomes. So this is the first in a series of videos by the Health and Wellbeing Queensland. I think it's a good capture of what health and wellbeing is about. So.
While our health may feel like an intangible thing, it actually impacts on every aspect of our lives, from our emotional and social to our physical well-being. So what influences your wellness? I'm meeting with esteemed clinician and medical historian, Professor John Pern, for insight into how historical health events may affect how we think today.
Welcome to our hospital.
Thank you. Thanks for having us.
In Queensland, there's no better historical example than the Spanish flu epidemic of the early 20th century.
It was the worst catastrophe ever to hit the human race. Somewhere between 50 and 100 million people died worldwide. We learnt, well, we being the world, learnt so much, and of course epidemiologists and preventive health experts, and wonderfully in Australia, our own political leaders have used many of the lessons from that 1919 pandemic to really guide and keep Australia safe today.
Can you describe the level of community concern when the Spanish flu hit?
Very similar to what we've experienced in the COVID-19 response, in that borders were closed, isolation was promoted, everybody wore masks, just as we're doing today.
The sun's shining down.
Fast forward from 1919 to the 70s, and health messages on TV started making an impact. They began to make us question our health behaviours and encouraged us to think differently.
Slop, slap.
Consumer and behaviour change expert Dr Joy Parkinson remembers this campaign well.
Slop, slap.
We know it's all about putting on a hat, putting on sunscreen and putting on a shirt as well to protect ourselves from the sun. Slip, Slop, Slap has really contributed to reducing rates of skin cancer and melanomas in Australia. These types of campaigns, take time to take hold, but they really ingrain what we do and make those things habits.
Walking is free.
It was the beginning of an era in public health messaging.
The 6 tinnies on this side, balance the 5 cakes.
As we came into the 70s, we really started to see some of those more people-friendly communication programs that really supported public health and really supported that change in social norms as well, so change in how we do things in society.
And when campaigns like these are combined with other measures like laws, public policy or services supporting behaviour change, the results can be powerful.
Other things like Life Be In It with Norm, when we were all getting TVs and VCRs and sitting around on the couch, and fast food started to become a thing.
Are you going fat?
You.
Some of the smoking campaigns as well, and they've worked really well, particularly in Australia, because we know, thinking about nobody smokes here anymore, so really changing that social norm around smoking and how it's antisocial.
Every cigarette is doing you damage.
It used to be a cool thing, but it's not cool anymore.
So we see history and public messaging shapes our health beliefs and behaviours. And according to dietitian and credentialed diabetes educator Michelle Tong, there are other factors at play.
I work with a lot of culturally diverse groups, and I think culture has so much to do with how people think and act in general, let alone, their health.
In what kind of ways?
So different cultures perceive, say, their health conditions very differently. So take, for example, diabetes. If Pacific communities might take it that, type 2 diabetes is God-given, whereas other communities would really listen to the health professionals in terms of, their advice on how to look after their diabetes. With all health conditions, we are all individuals, and in particular when it comes to cultural differences, we really have to consider what kind of background and understanding they're coming from in order to provide, the best advice that we could support them.
Food and culture are very strong. That would have a big impact as well.
Absolutely. I guess if you think about it, whether it is the foods that we eat, or whether you believe in meditation or abstain from alcohol, or the kind of mindfulness that you practice, all of those definitely play a huge part in terms of making, the health decisions.
For Daniel Weil-Wall, it was his upbringing and experiences after appearing on the popular TV series Ninja Warrior that set him on the path to holistic wellbeing.
I come from a family that survived on, the basics, so like rice, meat, root vegetables. Wellness is something that I think is something that needs to be approached holistically. So physical well-being, mental well-being, emotional, spiritual. So, it's not only about the physical body and what you eat and put into it, but it's the whole being. I like to ground myself and focus on myself and still get out and do things, but for me, it's just everyday life.
Today, the Townsville youth worker helps others on the path to holistic health and shares daily motivational tips on his social media platforms.
To share this now on a platform across all of Australia, it helps me tell my story and to show people that no matter where you come from or who you are, if you put your mind to it, you can really do whatever you want.
Health and wellbeing seems like a jigsaw made up of many parts. It can include education, societal, economic, environmental and personal factors.
Take a seat.
I'm keen to get Health and Wellbeing Queensland CEO Robin Littlewood's perspective.
So I understand now the external factors on our health, but what about those individual things, the personal things that we can do to improve our health and wellbeing?
I think that to function well, we've got to make a real commitment to our health. It can be one of the most important things that we can do for our own lives. Good health is actually made up of many things, not just a single focus.
And what are those things?
Some of these are exercise and movement, and really trying to find time for that in our everyday lives, and try to find something that you really like. Healthy food and healthy eating. Being mindful and having a really positive mindset, that's incredibly important right now. Getting sleep, but getting good sleep. Social connectedness as well, because it is so important to link in. All of these are needed and they're all equally important. The key, like everything else, is balance. We've all got the right to good health, and we've got to remember that.
While there are some factors that are difficult to change about our health and wellbeing, it seems there are things within our control. Look at what you can change, as small, gradual health changes can lead to big benefits. So there you have it. The picture of good health is actually a jigsaw of many pieces. And that picture is about feeling good and living and ageing well.
That video probably summed it up better than I could, I do acknowledge that I'm taking bits and pieces from all over the department in Queensland Health to put this. It's not all, certainly not all my work. This is taking on board that Queensland Health undertook some research about, well, what are the things that Queenslanders think are important in their mental well-being. And this is an extract from a bit of a research paper that in 2017 that identifies some of those things that are really important. Focus also couch with what are the barriers to stop us from looking after our mental well-being. Some of those are things that we can control of ourselves, and some of those things are external. But with these research papers was helped to form some of the work that is publicly available on our website that supports individuals in order to make a change to their mental health and well-being. In terms of COVID, you can go to the Queensland Health website and you'll find a series of information that's available to people about how to support health and well-being in the community and how to get access to healthcare services. I wanted to draw your attention to the Keep Well link, particularly, which is, I understand that there's some students online looking at how do they implement some of factors in study and how do they support that. And this is a link that you can go to find some of that information. In particular, your mental well-being, and this is providing some tools and resources that help you make those changes in that area and start to focus in that promotion and preventative healthcare space that make it easier to continue to maintain your wellness. Here's just some of the key focus from the comments made by Robin Littlewood at the end of the video. The key areas here around, staying healthy. Wellness is more than just about what you put in your mouth, but how do you engage with others socially? How do you learn and grow your mind? How do you show kindness? How do you have other experiences? And how do you round out and balance your life? Just some more information on those websites. Particularly the COVID experience where people were in lockdown or at home. What are some of the tips and activities that we can do to maintain that wellness when we can't do what we always would have liked to do? How do we make the use of different spaces to do that? This is sort of a common that we see around the place at the moment, that Queensland Health responded quickly in terms of the COVID response to try and give some simple and key messages in order to stay safe in the COVID environment. This is what we've been doing from the public perspective, but I'll move on to some of the responsibilities more that I have and what our experiences were in terms of the workspace here at Queensland Health. We'll come back to this vision here in terms of delivering healthcare. It is our responsibility to provide hospital settings and healthcare settings that actually we can deliver healthcare. Some of the key focuses in terms of delivering healthcare and what we want to achieve is our consumers as partners, not passengers, that they have a role to help us deliver healthcare, but also influence and engage in what the healthcare setting does provide. We want to try our best to treat patients in their own homes rather than in a clinical healthcare setting. Certainly much cheaper, but it's also about people feeling much more comfortable at home and supporting their wellness back to health. And data is routinely used to benefit both consumers and providers. How do we provide more access to information? I guess the next slide really would delve more into my role in terms of the department and how we have responded to the changing environment for the office environment for many of our department employees. And prior to COVID, I was leading the body of work about an accommodation strategy and trying to drive how do we change and contemporise the way that the Queensland Health government employees work we certainly work in an environment that is more designed for the 1990s, early 2000 contemporary office space, and we've moved a long way in 20 years. And certainly young people work in a much more different way. I know that prior to coming to Queensland Health, I always had a laptop. And when I came for my first day on the job in Queensland Health, I was given access to a desktop computer. That was a bit of a surprise. I thought that we would be moved along in terms of technology, but certainly we've moved a long way in the last 5 years since I started at Queensland Health. So when COVID came along, it challenged a lot of our employees who predominantly were expecting to work in the office. How did flexible working arrangements challenge our thinking about how we did our work and where we did our work? Certainly there was a quick adaptation. I think Queensland Health are actually really good at managing in a crisis. We've seen the coordination unit led by the Chief Health Officer stand up pretty quickly, the response to COVID from the public point of view. And that has led to how do we support social distancing in Queensland Health facilities, but also appropriate hygiene standards, and address people working more flexibly, working from home. We've seen a significant uptake of 80% of people have got some form of flexible working arrangements now in the department. And what's been a significant increase in uptake of technology. So a lot more people having access to remote tools, laptops, remote access, use of Teams and Zoom, things like that are significant. And we've seen a lot of benefits achieved out of this process. People are less distracted at home, being able to focus on their quiet work. There have been opportunities to be more healthy and get out and use the time that they would otherwise spend commuting, going for a walk in their local community, getting that 30 minutes of exercise every day. And that's been a huge benefit to people. But what's also come with that is a significant challenges for us. People, and they've put in some themes here, but certainly people felt a lot more isolated at home in the working environment. Their connection to a screen has become very exhausting. In the office, you might step away from your desk from time to time, but also there isn't that separation from work and home life, and that people sort of seem to be working somewhat longer at times, or it merges into the daily activities at home. That feels like you can't put that piece of separation between what you're doing and switching on to family life. Certainly something I experience at times too. My newborn son ends up on teleconference or video conferencing at home. We've certainly seen challenges from managers and managing remote teams, and that we need to respond to that differently. And our processes need to adapt and change. There's been a huge demand for different types of technology and access to that. People weren't prepared to be able to work permanently from home, and so some of those technology tools we need to adapt to. The piece that's particularly important for me is around environment, and that now that people have changed their behaviours and are working differently, we need to adapt and change our environment to support that. And that means different types of spaces, different types of tools in order to work effectively and productively, particularly in Queensland Health. We are in a model where you are given a desk and everything that you do is expected to be done from that desk. And so you want to talk to your colleagues, you disrupt others. You want to have your lunch. I mean, there are places to go and have lunch, but many people might eat at their desks. You want to work in a quiet space. Well, that's the space that you're given. So we're starting to adapt and change our thinking about, well, actually, we might need other different types of spaces that support our work differently. And so a lot of people are working on Teams with video conferencing. We're not entirely adapted. We don't have the spaces available to us in this organisation to effectively manage that well. So we're now looking at how do we actually make sure that we provide those spaces. This is a slide built with our partners around remote working will continue to be in our future. I think the focus of our work has been, this is the new normal, and how do we embed new normal activities? We're not going back to what we had before. And how do we ensure that we make the most of the change in the way that we work? So how do we continue to support a flexible working arrangement? 50% of people never had any kind of remote working activities. Now we're getting to the point where 40% of people want to work 3 to 5 days per week remotely. That's a significant change, and it's going to require a significant change in the way that we provide space. That means making people more mobile in the office and remotely, providing different kinds of co-working spaces. We know this is what people are telling us they want to come back to the office to do, and that is predominantly around collaboration. They want spaces to be able to connect and collaborate with others. They want to still have those training experiences face-to-face. They feel like if you're going to have a formal meeting, it's going to be done more appropriately on a face-to-face conversation. But happy to work more remotely or via video conferencing if we're having an informal conversation, a phone call. If there is quiet work to be done, I know I'm probably going to get a quiet space if I'm out of the office and I'm not going to be interrupted. That's as long as you don't have kids or pets at home. So what we need to provide in terms of our office, in terms of the environment, has changed. And that's not only going to help productivity, but it's also going to help people be in the right mindset and be much happier to be in those spaces. I know my own personal experience, working from home can be exhausting and can be draining because I don't have the right tools available to me, whether it's the right setup or I have some of those tools, but ensuring that I can designate that the office provides me with a bunch of spaces that are best suited to be coming into the office. And the remote space, I can try to focus my work on the quiet, introspective activities that I need to be doing. These are some of the spaces that we're looking at trying to provide more of and a different way. And this is what our staff are saying, that they want more meeting spaces. They want to be able to meet with big groups. They want a space, they want space where they won't be interrupted. And post-COVID, they're finding some of that available to them at home, as long as they don't have distractions at home. And so that's what we're working on. And these are some of the strategies that we're embarking on to understand what's required in order to design the new space. So how do we determine what employer provided workspaces there are and where they are located, what that fit out looks like, how we occupy that space, and how do we manage the facilities management of that space, that new type of space, and that those things need to change. So there's a significant body of work around doing that, and we're continuing on that pathway in order to make the workplace a more effective place to work. I imagine there is a lot of synergies here in relation to study and how do you provide the right spaces for students to work at their best in those different spaces. Last thing is I wanted to give, or it's the second last thing, give you a bit of a example of the healthcare setting and how we can design for wellness and how space impacts on people's ability to engage with the space. And you might be familiar that the Barrett Adolescent Centre in the western suburbs of Brisbane was closed down, and the government committed during the 2015 election to rebuild that facility. The Premier opened this particular facility at the Prince Charles Hospital campus in November or December last year, which now provides a medium space for youth with mental health conditions in order to provide rehabilitation for some of it's a community-based setting which is able to support outside the home, but with appropriate carers in order to improve their wellness around mental health. This is a bit of an example about the process we undertook in terms of designing that workplace to support its patients and how they were involved in designing the facility. So this is a flyover of the facility. It's now constructed and it's called Jacaranda Place. It's been basically spoke to that. It's a place for people, young people in particular. As I said, part of the process was about working with patients, carers, parents, in order, how did all of those spaces in that facility support people, patients getting better? Also, how did it support the staff to do their job well? Some of the examples relate to how you entered the space and how it made you feel. Some of the patients were asked in their teenage years what sorts of equipment they wanted in the place where they studied, and it was all designed to have formal desk arrangements. And one of the key takeaways was the students say, "I don't work like that. I sit on the lounge with my laptop on my knee and hurry away on my study." So that discussion and engagement with patients was a key collaborating influence on how this facility was designed. And so there were components of the facility that really were adjusted in the design phase in order to support the feedback that was received directly with patients about how this facility could operate. And here's another little video to explain in more detail that process and talk about the value that was achieved from it.
Hello, I'm John Allen, Executive Director of Mental Health, Alcohol and Other Drugs Branch of the Department of Health. I'm pleased to introduce the following video that highlights the partnership with consumers and carers that has underpinned the co-design elements essential to the successful design and delivery of the Youth Mental Health Program of Work. The Department of Health acknowledges the importance of engagement with people with a lived experience, including consumers, carers, families and significant others, in statewide policy development and planning and service delivery. This involvement of consumers and carers in the work undertaken as part of the Youth Mental Health Program has been critical to supporting the government's commitment in ensuring Queensland's young people have access to contemporary mental health care. This significant co-design contribution has been across service elements including Jacaranda Place, the Queensland Adolescent Extended Treatment Centre, 2 new 6-bed youth step-up, step-down units in Logan and Caboolture, and refurbishment for 2 adolescent day spaces in Logan and the Gold Coast. To enhance and expand the range of mental health service options available to young people with severe and complex mental health issues. The work undertaken to co-design both the look and feel of Jacaranda Place and the service delivery model and its implementation is a clear example of consumers and carers taking an active role in shaping the way in which services are planned, delivered and evaluated. In the next few minutes, you will hear the voices of our consumers, carers and service partners who have contributed to the co-design process for the capital planning and service delivery of Jacaranda Place. Operated by Children's Health Queensland Hospital Health Service, Jacaranda Place is now providing statewide inpatient treatment and rehabilitation for an extended period that fully integrates mental health and educational vocational training components, with the day program delivers an integrated model with the Department of Education. The model of service was developed following research, clinical review and co-design with consumers and carers, clinicians and our partners, the Department of Education and Health Consumers Queensland. I would like to acknowledge the valuable input from consumers and carers towards both Jacaranda Place and the broader youth mental health program of work, and invite you now to view the rest of this short video, which is a testament to their commitment and efforts towards these important projects.
A place where they're really treated as, you know, beautiful young people who can grow up to become whoever they want to be, and their journey is not constantly defined by admissions, but by having the space to heal.
It's a different model. It's subacute long term, which I think is really important because that will help young people get to know their treating team and gives them more time to work on things that can help them.
It feels a need, a genuine need. Currently, the only real services available for young people are extended chronic treatment in the community or acute crisis treatment in inpatient facilities.
I think Jacaranda Place is something that's so important because I could have really benefited from something like that, you know, when I was in that age range, and I think the fact that it's now available is so important. I think it's something very unique in the, you know, model of care across Queensland.
Education has been a very important part of this project. And I must say, a number of the families shared their lived experience of what it's like navigating not only the mental health system, but school and education, and what works so well and what we want to see in the new system.
The philosophy that we applied in our design was one that it had to be a safe and home-like environment. We wanted this still to be a therapeutic environment, but not institutional at all. So we spent a lot of time on replicating what a safe home environment would be for these adolescent patients.
The level of consultation was very extensive. I really loved how everyone's voices were really heard.
Consumers and carers sat on all of the high-level steering committee meetings. We were just able to be involved in everything, and I think that that is really reflective of the quality of Jacaranda Place and why it is the way it is.
As the architects, we were looking for a very high level of consumer input in this project. There was no precedent globally for this at all. This is a first anywhere in the world.
We had rooms set up where we could actually see what the bedroom was going to look like or what the dining room was going to look like. So along with the staff, the young people and the families were able to make comment and suggestions. When it came time to choosing cutlery and crockery, the young people were very adamant that we don't want that. It looks like aged care crockery.
This wasn't a process where I felt it was tokenistic, it was actually far from it. A group of consumers and carers were able to go and actually select furniture and test it and sit on it, such as couches and seats.
The minor details like, you know, can we change our air conditioning? What kind of carpet would we like to have here? What kind of activities? Where are we going to have these activities? You know, what colour are the curtains going to be?
I think in the past, mental health especially, and health in general, has sort of had this view that, like, you know, we as staff will tell you what to do because we know what's best. And I think having young people and consumers and carers involved in the creation of a new service and the running of a service, it's really moving away from that model.
A place of healing, a place where young people can go to get really, really robust support and have a treating team around them and supporting their family back home, their siblings, their community.
Somewhere safe to be and, you know, to help them live their best lives, sort of that recovery-oriented practice that we maybe you don't see in more acute settings.
A place where young people can go in and learn new skills, so whether that's, you know, interpersonal skills or whether it's more practical skills such as finding a job, continuing their education, getting a vocational profession, so it might be a barista course, a place where they feel that they can flourish.
This is a much more holistic approach to their mental health because it involves education, which is a really strong protecting factor for our young people.
I believe it's a really beautiful design. I think that the level of consultation really informed every aspect of it.
Well, it's the only one of its type in Australia, so we have a great opportunity, but we have a huge responsibility to make this place work. I just think it's a fantastic model.
My hope for Jacaranda Place is that it's replicated in other areas and you know, really expanded, the model of services expanded across Queensland and across the country, really. I think it's something that's could be doing amazing things for a lot of people.
I'm really happy that this exists. I always think back to my own experiences in the system, and even if not for myself, but for my peers, I really wanted something like this to exist.
So just to wrap up, I'm going to, the last column, I haven't talked about connecting care, but pursuing innovation. I just wanted to throw it out there about this particular model, and the Prince Charles Hospital Foundation are working on a project about how do we provide intensive care settings that are more conducive to wellness. And this is a image of a concept called the intensive care cocoon. Many people will be familiar in the public discourse about at the moment around COVID that patients in a significant respiratory state end up in the intensive care unit in some of our hospitals. And there is a limited amount of those in our hospitals, but you might have seen pictures, certainly in the Italy experience, of people in plastic cocoons, very noisy settings that are incredibly disruptive for a patient, and that a patient, when they're at their sickest, is often in these settings that are not very conducive in terms of the environmental setting about getting better. And many of people that are in ICUs for extended periods of time develop delirium and hallucinate around their settings, and that actually detracts from their wellness about getting better. This is something being run by the foundation and in partnership with others, but it certainly gives that concept about what is the innovation in this space, about how do we provide a setting that is more conducive and supportive of patients getting better, providing a cocoon of a very warm and cozy environment in order to support that wellness. And we know how expensive it is to run an intensive care bed. They're one of the most expensive components of a hospital. People are at the tip of the point of end of life. And so if we can reduce people's stay in an intensive care bed by a number of days, it makes a significant contribution to reducing the costs of running a hospital. And it also ensures that those patients have a much better chance of extending their life and returning to health. I'll leave it there, and thank you for giving me the opportunity to talk. I hope I've done other people's work justice and recognise their work. Most of what I provided is available publicly, and you'll be able to Google any of that yourself to read up more about those things.